when I was taking a walk down to Civil Hospital, I was pretty shocked to see what I saw.
Pediatric emergency room of Civil Hospital used to be in shambles and really an awful place to be in for not only children but for adults as well.
The walls had blood in it, oxygen was not functioning, it was in a terrible state.
Our chairman, Iqbal Azam ji, invited me over outpatient department at Civil Hospital.
And I told him, I said, look, I've seen something horrific. Do you think that you can come and see it with me?
We happened to walk into the emergency room at Civil Hospital, Karachi.
In that particular time, while he was there for half an hour, I think he must have saved 2 lives. And he said, Iqbal, we have to do something.
We felt that it would be much more impactful if we renovated the place, fixed it.
Maybe give some medicines.
Made it a little better environment for the children who were coming to the emergency room. When we wanted to renovate it, we figured out existing structure at that time was very fragile.
So he said, either you do nothing or you do it properly.
And in order to build the new one, we needed to raise money. And in order to raise money, we needed to have a platform. And the platform then became the ChildLife Foundation. So there was no great scheme, no great strategy, no great plan. It was just a small need for helping the children of Civil Hospital, Karachi in the year 2010.
ChildLife Foundation का एक ही मकसद है, पेशेंट केयर, वो भी क्वालिटी के साथ.
जैसे भी लोग आते हैं, हमारी पूरी कोशिश होती है कि हम उनको अकोमोडेट करें, उनका ख्याल रखें. वो आपके साथ जैसा भी बिहेव करे, अटेंडेंट है वो परेशानी में है, लेकिन बीइंग अ नर्स आपने उनके साथ हमेशा पोलाइट ही बिहेव करना है. जब हम उनके साथ इस तरह बिहेव करते हैं, हम उनके साथ कंपैशनेटली काम करते हैं, दुआएं दे के जाते हैं हम लोगों को.
मेरे बच्चे को काफ़ी अरसे से ये मोशन वगैरह और उल्टियाँ इसकी चल रही थी. काफ़ी डॉक्टरों को मैं दिखा चुका हूँ. जब मैं वहाँ लेकर गया बच्चे को तो माशाल्लाह से बहुत ही बेहतर लगा और बहुत ही बेहतरीन सफाई सुथराई और माशाल्लाह से डॉक्टरों की इतनी खुश अखलाकी से बात करने का, नर्सों का. बंदा बोले कि मैं अपने घर में बैठा हूँ, जैसा कोई अपना ही किसी का खिदमत करता है.
My reason for joining ChildLife Foundation was I know if I'm coming to this organization, at least they'll be talking about the protocols, the right things are being done, and there is a lot of check and balance as well. So we are accountable of the management and the treatment we're giving to our patients.
ChildLife Foundation main value is humility, ajizi, inkisari. Because if one is humble, only then one is willing to learn new things, learn clinical protocols.
My daughter, when she was born with certain diseases. I was sitting along with other parents, and I could see that, of course, they are worried for their children, but they were more worried about the bills and the finances they are going to encounter. Since then, I decided that, inshallah, if there is an opportunity, I will really contribute because I experienced that, I saw that suffering through my own eyes.
ChildLife Foundation is managing 10 children emergency rooms across Sindh and Balochistan. All the tertiary care hospitals where the poorest and the sickest children arrive is managed by ChildLife in partnership with the government. And it's a partnership that spans 10 years. We have demonstrated that you can work with the government because real impact comes when you work at scale.
We have had a very smooth relationship with the ChildLife Foundation, and I have noted that it has increased its sphere of influence, not only within our civil hospital, then it moved on to the NICH and further on to Korangi Hospital, and now it is spread all over Sindh.
The kind of work that ChildLife Foundation had actually achieved, the results, the impact they had made, the ER at the National Institute of Child Health was exemplary.
We are also very grateful to the Sindh government, the Balochistan government also, that they have supported us also, and they have also supported hugely our telemedicine program.
ChildLife के employees, ChildLife की team हमारा असासा है. You are what ChildLife is. ChildLife दीवारों का नाम नहीं है. ChildLife की कामयाबी सिर्फ और सिर्फ आप लोगों की वजह से है. नौकरी तो ज़िंदगी में सब लोग करते हैं, लेकिन बामकसद काम करने का मौका खुश नसीबों का मिलता है. तो मैं समझता हूँ कि हम सब बहुत खुश नसीब में हैं कि अल्लाह ने अपने काम के लिए हमें चूज़ किया.
Seeing and witnessing that collaboration of these human resources of Pakistan achieving the kind of outcome and results that ChildLife has, alhamdulillah, been able to achieve, just so gratifying and humbling.
It's hats off to them, because we are sitting in our rooms making a strategy, but they are the frontline people who are making is actually turning this into a reality, right?
जो जूनियर कॉलीग्स हैं उनको हम सिर्फ एक बात ये बताना चाहते हैं, और अल्हम्दुलिल्लाह दे आर वेरी एनर्जेटिक, कि people they don't care how much you know, they just remember how much you care.
असांजी दुआ गॾु थियनि असांजे ॿारनि जी, जो असांजा बच्चा सही था कनि त असां दुआऊं छो न कंदासीं ने, असांखे मुफ़्त इलाज थो मिले या छा, असां छो न दुआऊं कंदा। अलाह आबाद कर रखंदुनि, ख़ुशि रखंदुनि, सदाईं ख़ुशि हूंदा पंहिंजे बच्चनि सां, जो असांजा बच्चा ठीकु कया अथऊं।
इससे बेहतर मैं कहता हूँ इंसानियत में कोई चीज़ है ही नहीं। इतनी बड़ी इंसानियत अगर कोई करता है वो तो बड़ा ही दिल वाला करता है।
To our supporters, I would like to say that keep your humanism alive. Keep giving. Allah has promised that Allah is going to reward you many folds, and we have seen that in our lifetimes happen. At the same time, whenever you are contributing, do ask the question that if you have only $1 or 1 rupee left in your wallet, if you have only 1 second or 1 minute left on your clock, try to invest it in the next generation, in the future of Pakistan.